Welcome to Save Your Money, Save Your Teeth here on E-Radio, the go-to podcast where curiosity meets dentistry straight from the experts. We're joined once again by Dr. Clifford Udelman from OptiSmile and ready to take a deep dive into the world of dental care from a consumer's perspective. If you're looking to brighten your smile or protect your wallet, we've got you covered with practical advice and the latest insights. So stick around with us for the next couple of minutes as we uncover the secrets to maintaining both your dental health and your finances. It's a very big hello and welcome again to you, Dr. Udelman.
Hi, nice to chat to you. Hope you had a good week. Thanks for having me back. Looking forward to today continuing with digital dentistry today, and then next week will be our last. There is some overlap, but we go deeper as I explained last time, and we did get a lot of interest to last week's podcast. So
fantastic.
Let's get going today. Yeah.
Awesome. So continuing with digital dentistry, I've heard that digital dentistry can actually spare more of my natural tooth. How does that benefit me in the long run, doctor?
Preserving your natural tooth structure is like keeping the foundation of a building intact. When we use digital tools like intraoral scanners, we've got several different scanners here at OptiSmile, and now with AI-assisted design, we're able to see your tooth in incredible detail. And that clarity, lets us restore and to preserve more of your healthy tooth. We can do more inlays and onlays rather than full crowns, and you maintain better overall strength, which helps to avoid fractures and breakdown in the future. We always say less is more when it comes to your teeth, and we do have an episode about inlays and onlays. So, this means fewer appointments. We can do these often in one appointment where we prepare the tooth, save as much of the tooth as possible, scan you, use our design tools, and 3D print or mill a restoration and bond it in place. And it's a higher likelihood that your tooth will remain durable for many years, and that will help support your overall oral health.
These new scanning and AI tools sound really great, but I want to ask you, do they really make treatments more comfortable and precise for the patient?
Yes, they genuinely do. Traditional methods, impressions, can trigger gag reflexes or discomfort. And as we touched on before, digital scanners capture a highly accurate 3D image of your teeth in a matter of seconds. It not only improves the accuracy because the margin for human error, like in mixing the impression material or how quickly you get it in the mouth or the temperature of the room, can all affect traditional impressions. Then traditional impressions have to be poured up, made into plaster models, and they have to be transported. So all of this is all cut out. You get a digital record that's super accurate. It is more comfortable. It processes these images, and we can enlarge them on the screen so we can see, tiny spots of decay or misalignment, things that we may otherwise miss. And the end result is a more precise diagnosis. And in the case of using scanners during treatment, much more accurate molds or scans, and a significantly improved experience when you're in the chair.
Now, I know you like using AI, doctors, so I want to ask you, how does AI help spot or prevent future dental issues before they actually become painful or too costly?
Yeah, so you need to think of AI as an extra pair of eyes that can help to detect subtle changes that we can't easily see. Use something called DiagnoCat that will see very fine differences in like shadowing on a tooth, and then it will mark it or highlight it for me to look at. In the end, I have the final say as to what we're looking at or how the diagnosis goes. But the AI algorithms can pick these shadows or different lesions up on digital x-rays, and by catching issues early, we can treat them with minimally invasive techniques like smaller fillings instead of waiting until you get root canals. And this ultimately saves you money, time, discomfort. It will also detect any recurring infections. If you've got a root canal that wasn't done that well, or there's another issue with it, it will detect problems early, sometimes before we're able to see it with the naked eye. Yeah, if you look long enough and close enough, you tend to see everything. But this is, as I said, like a second pair of eyes. And early detection means that you're less likely to get sudden tooth pain down the line, obviously less treatment down the line.
And how do digital scans and AI ensure that I only get the treatments that I truly need and also not miss any hidden problems, doctor?
So when we scan your mouth, the software produces a very detailed 3D image of every tooth surface and the surrounding tissue. We can see around the very back of your last tooth, especially on the uppers, which is harder. I mean, we use a microscope and with very bright light and mirrors, and we dry the teeth and we look back there. There's new software that's just been released at IDS, a big international show in Cologne that they have every 2 years, which is very exciting because that will actually read cavities on the actual digital scans as well as on the x-rays. So we're just waiting for that. Yeah, because it's all digital, we can zoom in, we can rotate the model, we can see where your bite forces are. It helps us to see how your teeth come together. We can confirm things that we see on the scans clinically. I usually sit with a patient and look at their photos and their x-rays, their AI report and their scans. And then I only look in their mouth during the last 10 or 15 minutes of the appointment. We might spend an hour chatting and getting all of these different scans and x-rays, etc. And by the time we look in their mouth, they already know everything or have seen pretty much everything. We just look in the mouth to confirm or to do any further tests, like an ice test or blow air on a tooth or tap on a tooth or check how your bite is with some bite paper. But, it just combines the AI analytics with our professional judgment, and we ensure that you get only the treatments that are relevant and effective.
And I hear digital tools can also guide the choice of your crowns or veneers. How does it actually help me pick the best option?
In the Invisalign system, we can give people a preview of how their teeth will look if they just do braces or Invisalign to move their teeth into position. And then we can instantly also give them a preview with in their InSmile photo. It's called a iTero outcome simulation of what the teeth will look like with veneers or crowns. And we help patients understand the size and the shape of the teeth and how maybe creating gaps between your front teeth so we can make your front side teeth bigger in the case where those teeth are too small. You can preview all of that ahead of time. And with this tool that we have now in the iTero, we can do that at your very first visit without any additional cost. And it helps patients, feel more confident and helps them towards making a decision when they see what the end goal is from the beginning. You work with the end in mind.
Is digital dentistry more eco-friendly by cutting down on waste, and why should it matter?
Yeah, look, when we take molds and impressions, there's the plastic trays, and then there's all that silicone, and that stuff lasts forever. There is an issue, and there's a lot of talk about dental printable models. We've just got a new printer at OptiSmile where we'll be able to print retainers, aligners, and bite plates without even printing a model. So there's no added plastic or wastage. We reduce the need for transport to send, to package up and to ship or to use a courier to take a model to the lab. When we're using a lab to make crowns or dental treatment for us, it gets transported through the internet, basically through a portal securely. There's obviously it's all HIPAA compliant and what we call POPI compliant for South Africans. And yeah, it's eco-friendly from that point of view as well.
Okay, that's fantastic. And how much training or expertise should I expect from a dentist who's fully digital, and why would it matter to me?
So any dentist who commits to a digital practice invests heavily in training not just in using the equipment, but also in interpreting the data. It's a whole new way of working. For you, that means an expert who can make sense of these scans, who can use the AI. A dentist with strong digital expertise is better able to spot issues on these scans and on these digital x-rays, especially something like a CBCT, which is a cone beam, or a 3D x-ray. We've done an episode on x-rays. Ultimately, the higher level of digital training you have, the more reliably you get predictable outcomes. I've just signed up for a 2-day 3D printing course where they're launching some new 3D printers, which are not yet available in South Africa. So I'll be spending 2 days doing this course, not this coming Friday, the following. And those courses, the dentists that I'll meet there at the course, you'd have to be very committed. They charge for just a 2-day or 1.5-day course. It's going to be costing about 12,500 Rand just to do the course. They don't give you anything for that. That's just to gather information. There's online courses. At OptiSmile, we've signed up for 2 online 3D printing courses that myself and the dentist will be watching, and they each $1,000. So that's another 18,000 Rand for each of those courses. So just, we don't just buy a printer and start using it. For printing models, that's one thing. But when you start now with all the newer materials and so on, you need proper training, because it's not just, you're dealing with patients' teeth. You're not just printing little toys or something,
Yeah, absolutely. And, these digital scans and the AI insights, could they make me feel more in control of my treatment plan? Do you think they would make me feel that way?
They truly can. Imagine seeing a digital replica of your teeth on the screen, understanding why certain issues need attention. When we do a scan with the iTero, we have the oral health suite, which we can turn off the color on your teeth, and we can just see as if it's a plaster model, and we can see wear facets, where your teeth are wearing down. You can see if your teeth are getting thin. There's near infrared imaging. All of this is empowering, because you're involved in every step of the process, and you can ask targeted questions and make informed decisions and feel confident that each treatment suggestion has a clear rationale behind it. It shifts the experience from simply following instructions to becoming an active participant in your dental health. We call it co-discovery. We're both seeing your teeth for the first time, because we look at the scans together and the x-rays together and the photos together. And then co-diagnosis, where, once we've looked at something and we've discovered it, and then I point out to you what's healthy or what's not healthy, or that there's wear on your teeth and you're not aware of grinding, and I discuss the grinding, the diagnosis, and the actual discovery. So we all use that at OptiSmile, and it's really quite magical when you do it properly.
And then, Dr. Yudelman, how do these technologies ensure my new crowns or veneers perfectly match the color and shape of my existing teeth?
Yeah, so we're very excited to be getting all the new 3D printing resins. They really match teeth even better than the ceramics. There's some high translucency ones. We'll be able to print 3D print veneers, super, super thin. Ceramic needs to be at least 0.5 millimeter, which means you've got to drill away the tooth. We're looking forward to printing no prep veneers, which can be as thin as a 0.1 of a millimeter. You print them at about 0.2 or 0.3, and then by the time you polish them, they can be literally see-through and change the shape of your teeth. Obviously, for changing shade or color, there's other much more opaque or white materials for people that want that Hollywood smile. We did do a episode about the Hollywood smile versus the natural smile. At OptiSmile, we do go for the natural smile wherever possible. We try not to promote very, very white or super straight teeth. But I do suggest people, if that now that I mention it, go back and listen to some of those podcasts. The digital design software can actually copy, say you're getting one tooth done in the front, we can actually take the scan and do a mirror image, take your one front tooth and flip it around on the computer and do an exact copy to the other side, because part of beauty is symmetry, and that should have to be done by someone by hand, and building that up manually with wax and so on before. But now it's done in a second, and there's so much AI coming. There's on a Sprint Ray cloud. When we upload scans, we can order certain things using AI, and they come back in 5 minutes, and the designs are perfect. It's unbelievable. As you can tell, I'm very excited. Matching the shape, it matches with your natural anatomy. We can refine it, so if we want to put our own little touch into it, and then we can decide we want to mill something or we want to print it. Now that these materials are being launched in South Africa and in Europe, they've been available in America for 3 or 4 years, but obviously they've been perfecting them over that time. So look out, 3D printing is coming in a very big way to advanced practice near you.
OptiSmile, of course.
Yes.
Yes.
OptiSmile near you.
Absolutely.
We are actually franchising, so look out for some OptiSmiles throughout the country. We've had interest from all over the country, so that's just a little sneak.
That's
snuck
great.
that in there. So yeah, our podcast is really spreading far and wide, and we've got a lot of interest from dentists that want to own an OptiSmile. So, and the first thing we'll be putting in is a 3D scanner, a 3D CBCT X-ray machine with AI, and a 3D printer, a Sprint Ray Pro 2 or a Sprint Ray Midas, which is the new one, which isn't available yet. That's made specially for printing veneers and inlays and crowns and implant crowns. Yeah, so look out for that.
Very exciting times, Dr. Edelman. Just one more question. I've heard about same-day crowns. Can digital tools really make that happen, or what does it mean for my schedule?
Same-day dentistry is amazing to be able to get a new tooth without having to come back and get numb again, without needing a temporary crown. Designing the tooth digitally, especially now with instant AI. We've been doing same-day crowns and onlays for ages, especially on back teeth. But now with the 3D printing of non-prep veneers, we're looking forward to printing these super thin veneers. We can print 10 veneers in 10 minutes, whereas to mill something, you can't mill something that thin on a CAD/CAM system. So printing really is the only way to go for that. And it's very, very fast. You can print 1 in 10 minutes, or you can print 20 in 10 minutes, because they all go on the same platform. And the platform is huge. It's made for printing models, and veneers are really tiny. So there's no end. You could probably print 100 veneers in 10 minutes if you had 10 patients lined up for 10 each. But yeah, it's
incredible. Yeah, it's unbelievable.
Yeah.
It's futuristic. It's insane. Hello to the future with OptiSmile.
Hello, future. Yes. And wait until next week, where we have even more on digital dentistry. I'm so pleased people are happy in this. I mean, happy and excited to hear about this, because I love talking about it. And yeah, I hope you have a good week, and looking forward to next week's episode.
Thank you, Dr. Edelman. Same to you. And yes, I have some more questions for you next week. So I hope you're ready. I know you are.
Fantastic. Thank you.
And that wraps up today's episode of Save Your Money, Save Your Teeth. Once again, big thanks to Dr. Clifford Edelman from OptiSmile for sharing all the amazing information with us and his expertise. And also thanks to our listeners for tuning in. Share the podcast with your friends and family. And also just quickly remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. And don't forget to subscribe as well for more enlightening discussions. Join us again next time as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Udelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.